vilifying the insurance industry as being the primary driver of poor health outcomes or denials of care takes away a lot of the personal responsibility that we have as consumers and also societally.
We want to improve experience and care and outcomes for our members.
The ultimate goal for insurance companies is to keep populations healthy. The health system in itself is a creditor that has never agreed to offer free credit to people.
Welcome on into the Health Elevated podcast. I am Dr. Fowers, joined by Dr. David Hedges, and we have a special guest today. His name is Charles Baker. He's the Vice President of Compliance Solutions at ATTAC Consulting Group. He has degrees in social work and healthcare administration and a lot of experience that he brings to the table, as today we are going to be talking about how to optimize health outcomes, a consumer's guide to navigating providers and payers. A lot of news is going on right now where people feel frustrated with the healthcare system in the United States. Consumer, or the patient, us, everyone, is kind of caught in between two companies, because that's how it works, right? It's a capitalist system. The healthcare system needs to make money at the end of the day. The insurance company is a company. They need to make money. And the poor patient is caught in the middle of these two corporations, essentially. And sometimes they get, I think, left behind, unfortunately.
Yeah, I think we've historically developed a really complex system basing our healthcare payment based out of our employment agreements, right? And so by nature, it's a capitalistic environment because our insurance and the way that we cover healthcare is traditionally through our employment. And as a contingency to that employment, our healthcare hinges on that. You know, there are government payer programs that are just as complicated as the commercial insurance industry. But, you know, think of the experience through your commercial insurance programs and the complexities that are there. Now throw the government regulatory and oversight concerns on top of that for your Medicare, Medicaid, and Affordable Care Act marketplace patients as well. And so what we've built is a very complex system that a lot of the times leaves the providers and the patients in the dark just based on the lack of knowledge on how all those things are interrelated with one another.
So in your experience, this whole complicated procedure, like the two kind of titan corporations working against each other, does that have negative effects on consumers of healthcare, so patients or insurance members?
Yeah, I mean, and I think that that's what we're seeing in the news today, right? I mean, and the headlines are prior authorizations are denied. The care that members are needing at the place of service that they're needing it at are being denied by insurance companies. I was watching a video on LinkedIn yesterday. That was a breast cancer surgeon stating that she got a call from a health insurance company while she was in the middle of her procedure, while she was doing surgery. And the person on the phone was trying to validate or pre-authorize the patient's post-surgical stay in the hospital. And the surgeon said, well, you've already approved the surgery. Wouldn't you have all this information that you're asking me for today to also approve the inpatient stay post-surgery? And the response that the surgeon got back was, no, that's a different department. I'll have to ask somebody else. Right. And so that just speaks to the fragmented nature of our healthcare system, that even internally amongst these large payer organizations, we have created these silos where the surgical authorization, the information necessary to approve a surgery case for somebody with breast cancer, it doesn't speak to the people that are doing the aftercare for these patients as well, or the need to do inpatient level of care.
Yeah. So Charles, what you just described, it seems kind of like insurance in this case is kind of like the boogeyman, like really kind of like causing problems, delaying care, causing these issues. But, and I'll share, my biased perspective. I work for an insurance organization, health insurance organization. And I would say that the overwhelming, now this could be specific to my organization, I don't know about other health insurance organizations, but the overwhelming mentality is we want to improve experience and care and outcomes for our members. That's the conversation that comes up no matter what department I'm meeting with. That's the conversation. I've even seen this, realistically in our current system. If a patient is healthy and needs no care or very little care, then the insurance actually benefits financially. However, if a patient gets sick and if a patient needs ongoing care, then the provider side, so physicians, tend to have, they're financially compensated. So in many ways, you could say that in our current system, physicians benefit if people are sick and continue to be sick, where insurance benefits if people are healthy. Does that match your experience as well? Or
Yeah, I mean, and that's the altruistic goal, right? That's what we're all trying to accomplish, is to keep our members healthy. Now, I was listening to one of your previous guests make the comment that there are millions of really good physicians out there that are doing the good work to keep members out of the hospital, even though it won't be financially lucrative to the hospital system itself, but it's the right thing to do. And I think insurance companies are vilified inappropriately at times for working within the system that we've been given. Now, I mean, there are specific use case scenarios where there have been some bad actors, that there have been instances where appropriate care has been denied, that timely access to care has been denied from an insurance level. But ultimately, back to your original point, David, I've worked in the insurance industry a long time. I've worked for an insurance company, and at no point in my career have I ever heard an insurance company CEO say, "Don't give patients the care that they need." Right? The ultimate goal for insurance companies is to keep populations healthy. And we in the United States have done a really bad job of taking that population to health approach to keep people healthy.
Well, I'll push back on that just a little bit because it does depend on the insurance company. Certain insurance companies are publicly traded, and so their ultimate goal is actually to make money for their shareholders, right? That's how it works in a capitalist society. Not all insurance companies are like that, but I think if you break it down, you could easily make that case that it really comes down to money. Since it is a business, though, and they're trying to provide a service, right? They're trying to make the care more affordable for individuals. And to do that, like the system works where they're essentially banking on the fact that not everyone is going to get sick.
Mm-hmm.
Everyone puts money into a pot and only so many
Right.
get sick, but those people are taken care of. But I think one of the issues that maybe not enough people are talking about is the fact that the population in the United States has gotten progressively more obese, more sick, and that is driving up costs because of what I just outlined of how the business actually functions.
Right.
So how much of this blame that people have against insurance companies might actually be due to the people themselves, the population, the culture that is overfeeding, not exercising, not performing these healthy behaviors, and ultimately driving up the cost for insurance for their neighbors.
Yeah. I mean, look, we all have freedom of choice, right? I mean, we live in America, and we hang our hat on the freedoms that we are offered. And listen here, Mr. Insurance Company, you're not going to tell me to not go and have my glass of wine and not smoke my cigarette and not wear my seatbelt, right? We all have these personal liberties and freedoms associated with it. And so there is some level of personal choice. But I want to get back to what you were speaking to earlier in regards to for-profit, business-oriented health insurance companies versus the non-for-profit or non-for-profit, I want to use air quotes here, non-for-profit health systems or health insurance companies, because look, just because we say that it is non-profit doesn't mean that there isn't a profit associated with it, right? So the insurance companies that I've worked for have largely been associated with physician and provider groups and are 501c nonprofit organizations. But guess what? We're still aiming to get a 4% profit to be able to reinvest back into the organization. And honestly, I think what you have seen over time, and especially since COVID, is that there is a heavy reliance on those those provider-owned payers to rely on the insurance system to be the gatekeeper for their finances, right? They are really relying upon the insurance organization to control cost, one, first and foremost, and then two, be a profit margin for them, right? And so combining the between those two systems, you can stay at kind of that level of nonprofit status. If I'm a large health system and I own an insurance company, pick any health system, any insurance company. I am not being specific to anybody in particular that I've worked for, that you all work for as well. But those academic or other large health systems within the industry have lost millions upon millions of dollars through COVID based on reimbursement, bad debt, charity care. It is a game that the provider organizations are fighting against due to decreasing reimbursement from Medicaid and Medicare. And so by virtue of the work that they're doing, the health system in itself is a creditor that has never agreed to offer free credit to people, right? And so there is a certain level of financial loss that the health system itself is experiencing on a daily basis to take care of people that are critically needed to take care of, right? In steps the insurance company, right? So if I am a provider organization that owns an insurance company, and my insurance company is responsible for providing utilization management or implementing prior authorization, making sure that patients are getting the right care at the right time and paying for it appropriately. If I am expecting that insurance company to do care management, to take care of, identify, you guys are data scientists, right? So identify those patients that are high utilizers, that have chronic conditions, that we want to get into the right place of care at the right time to ultimately decrease the cost on the healthcare system, right? And so now, by virtue, we are relying on the insurance company to participate in those care management activities to help keep those patients healthy while getting them to the right point of care.
So what you were saying kind of prompted something within me. So, and I think it's worth, like we've been talking some of the negatives here about what's going on. Like obviously, like our system's trending in a way that's probably not financially stable. I think we all recognize that. I think our costs are roughly 2 times our healthcare costs nationally in the United States are about 2 times that of our economic peers, which is not sustainable. And were we to bring our costs back to the level of our economic peers, that would open up almost 10% of the economy that can be allocated in other ways. So we could see pretty tremendous gains across the board if we were to reduce utilization, reduce all those things. But I think that it's worth calling out. I mean, you mentioned before, Charles, one of our previous guests said there are many, many, many physicians who are trying to do what's right. There are many, many insurance organizations who are trying to do what's right. And while the system, I will be one of the first to admit, the system is probably broken, there are still tremendous gains that we're seeing in the United States. Interactions with the National Institutes of Health and the research that they're investing in, we are seeing those gains. If you look at specifically like oncology, National Institutes of Health have dumped billions of dollars over the past 40, 50 years into oncology research. And in the past 10 to 20 years, we're seeing the results of that. Whereas 30 years ago, a cancer diagnosis would essentially be a death sentence. Today, it's not. And that is something that is tremendous. It costs a lot of money to do that. It costs so much. It costs on the provider side. It costs on the payer side. It costs on the research side. It costs on the consumer side. But we are able to see essentially what 40 years ago would be miracles in today's medical system. And along with that, if you have a problem and you can't pay for it, but you walk into an emergency department anywhere in the United States, you will be seen by a highly trained physician and you will be taken care of. Now, follow through and like after your discharge, that's a different issue that we need to work on still. But if you go to a hospital, you will be taken care of irrespective of your financial situation. And that's commendable. Even though that costs us a lot nationally, that's impressive to me. I think that's something that we really should, be lauded for. And I think the consequences of this, I think a lot of health systems write this off as charity care. large health systems see upwards of hundreds of millions of dollars of charity care. And this is care that they give to people who cannot afford it and that the health system never expects to receive compensation for. No health system is balking at that right now. Every health system that I've been associated with and that I've read about just happily shoulders that burden because it's the right thing to do. So we're in a system right now where I feel like, yes, there are some bad actors, but I feel like those are probably the exceptions rather than the rule. But the system itself is leaning to non-sustainability. And I feel like this is probably just coming down to, incentives being misaligned between payer, provider, and consumer. And I think that those are the challenges that we're going to need to solve to make healthcare financially sustainable over the coming decades, is how can we really align those incentives, both financial and the incentive to do what's right, so that when an action is taken, it's not just going to be taken for financial reasons, but it's going to be taken, to make the best financial situation as well as the best patient situation.
I think the word that was used the other day was heroic medicine, right? Like we are really good at the heroic medicine. We are really good at the flashy. We are really good at the flashy and making sure that there are positive health outcomes for unique diseases, for emergency cases. What we are not good at doing is keeping populations healthy and not needing those heroic type interventions. I'll give you an example for this. So, originally when I started out my career, I'm a social worker by background, licensed clinical social worker. I had altruistic endeavors of wanting to change the world one patient at a time, and I worked on an inpatient psych unit in the state of Minnesota. And annually we saw within my 12-bed unit within the hospital, we saw maybe 2,000 patients a year would cycle through our unit. The problem with that was it wasn't 2,000 unique patients. It was about 200 patients that cycled in once a month. Right. And so what was happening? We were really good at getting patients healthy, doing well within a confined environment. And then we would send them back out into the community to see community levels of care, to have community-based interventions that should be supported through population health initiatives and other ways. But that system failed them. Right. And so they knew that they could get the critical access level of care, the heroic level of care by going into the emergency room while very sick, and that they would be admitted to the hospital for the care that they could, that they really needed.
Is something like value-based care or proactive care as an insurance plan a potential solution for some of this?
Yeah, and I think that's really, again, where that provider and payer relationship really synergizes, right? Again, I don't want to take this as a negative approach, because I think that a lot of the times insurance companies are inappropriately villainized for a lot of this, when it's a triple-sided sword or a three-legged stool, if you will. It's the patient, it's the provider, and the insurance company. There's three people here, and it takes at least two of them to dance. So when you have that relationship, I think that the payer provider and how they come up with payments and move towards a quality based, not just risk based, but a quality based payment initiative around certain conditions. I agree with one of your past guests who alluded to, you can't do quality-based payment arrangements and risk-based arrangements for every condition. You can't have bundled payments for every condition. There needs to be some sort of a fee-for-service environment in which that emergency level of care is paid for. But within those value-based arrangements that primarily rely on quality metrics, take inpatient, sepsis, right? Like if you acquire sepsis within a hospital environment, right? The hospital should have some onus as to how that patient got sepsis, right? And so should the insurance company be on the hook? So that's where you see those value-based payments, that I'm going to pay you for an outcome. Like if that patient goes through their hip surgery and gets outpatient and doesn't get sepsis, good on you. You get to keep the rest of that money. But if during that hip surgery, the patient gets sepsis and you have to admit him to the hospital and they have to spend 3 weeks in the hospital getting IV antibiotics and whatnot, you bear some of that responsibility through whether or not it was through cleansing or whatever the intervention was that caused the sepsis to happen. But you're on the hook for some of that.
I really like the accountability aspect of value-based care. And I'd like to get into it a little bit more later. But you mentioned something in your anecdote just now about talking about inpatient psych, where patients came in and did well while they were in the system, but where they broke down was after they left the system. And Rylan, earlier you mentioned, how much of the rising healthcare costs are that we're just seeing increased healthcare needs because people are less healthy. Our healthy behaviors as a nation really aren't where they should be. We're seeing increased, ever increasing obesity, ever increasing, unhealthy behaviors. And we can see that, the rise of social media has prompted likely prompted a huge, almost catastrophe in terms of, nationwide mental health. There's a lot of these things where we're not doing healthy things. We're not eating well as a nation, and we're seeing the consequences of that. So how much of, the current crisis in healthcare maybe isn't due to insurance and physicians and consumers, but more it's due to our culture, and it just becomes manifest through the economics of the healthcare system. So, where you have unhealthy behaviors through your life, maybe inadequate access to the appropriate, maybe you live in a food desert, for example, but inadequate access to clean water, clean air, and then the healthcare system essentially picks up the tab later in life when those issues start to manifest. So I'm wondering right now, the healthcare system, it didn't just arise out of nothing. It didn't set out to create a disaster. Maybe it's only a disaster right now because of factors outside of its control. I think, I once saw statistics where at best, only about 5% of a patient's overall health can be tied back to the healthcare system. The rest of it comes from healthy behaviors, genetics, your environment, whether or not you're vaccinated. All of these things have a huge impact where only, 5%, maybe even less, comes from your interactions with the healthcare system. But then the healthcare system has to pay for the bad effects of all of those other factors. And how much of it is the responsibility of the healthcare system to fix those things that it doesn't actually have direct control over? Because I think you mentioned this, in the United States, we value our freedoms. I don't want a health insurance company telling me how to act at home, but then the health insurance company has to pay for the effects of my bad actions. And this is an interesting concept I'm just kind of landing on right now.
Yeah, I mean it's the way that our society has been built, right? I mean, if you look at and I hate using the European versus the American model, right? I mean, we can talk about, Europeans getting rid of food dyes and high fructose corn syrup and whatnot. But there is something to be said about that, right? I mean, because those investments in population health and preventing a lot of those long-term diseases. What is the instance of diabetes and obesity in the United States versus that within the rest of the year or within the rest of the world, right? I mean, we clearly have a problem with obesity and diabetes. And what are some of the reasons for that? I mean, we don't have access to parks. We don't have, access to healthy foods. I used to give the example when I was teaching epidemiology, and this was back before COVID, and this reigned true, but it was cheaper to go and get $1 hamburger. Now that hamburger is probably like $10. But it used to be cheaper to go get $1 hamburger at McDonald's than it was to go and pick up an organic carrot at the supermarket, right? And so if you're trying to feed a family of 4, what's easier, going and buying $4 hamburgers or having to go and buy 4 carrots and then I have to go home and cook for them, right? And so the system that we have set up in fast food and all of the like has gotten us to where we are today. And so again, I think, vilifying the insurance industry as being the primary driver of poor health outcomes or denials of care takes away a lot of the personal responsibility that we have as consumers and also societally, right? It takes the responsibility away from the way that we have arranged our society to be focused on conveniences.